Good morning, everyone. I think I should say, although I shouldn't have to say it, but I should say for the record that I'm speaking in my personal capacity. I'm not representing any health service. And unfortunately, or fortunately, you be the judge of that, I don't think I'm representing the views of many of my colleagues. However, I think the first thing to say is that we need to view the Children and Young People Scotland Act as the logical outcome of a process which has been marked by a raft of government policy documents that have paved the way to legitimize greater state intervention in families, and not just deprived or disadvantaged families, but all families. So you look at the number of documents, you'd run out of time today to go through them all. Things like the Early Years Framework, the National Parenting Strategy, and of prime importance, Gothic, Getting It Right for Every Child. This is the government's national practice model for health, social work, and education services. Now, as people have already alluded to, the Gothic Framework was piloted for some time in the Highlands, but has recently now been rolled out across Scotland. Gothic had already established the named person in universal services for each child, and also established the lead professional to coordinate and monitor multi-agency activity. Gothic also emphasized that there had to be the capacity to share information across agency boundaries. So this was already well established in the Getting It Right for Every Child. Two very strongly held beliefs underlie this increased intrusion. The first is the conviction, absolute conviction, that the early years in children's development, in other words, the first 3 years, are critical if they are going to realize their potential and become, in the lingo, successful achievers as adults. And that if early development, this critical early development, is threatened by inadequate or harmful parenting, a child's future will be indefinitely blighted and they will become problem adolescents and adults. That's the first very strongly held belief. The second is the belief that without early intervention to counteract neglectful or poor parenting, the impact will not just be on the individual child, but will result in social problems in the future. Consequently, of course, the state then has an obligation to intervene in families in the interests of society more broadly. Now, these themes are echoed in numerous government policy documents. So, for example, Maggie alluded to the latest national guidance for child protection in Scotland. The government love these lofty statements, so this is one of them. It wants Scotland to be the best place in the world for children and young people to grow up so that they become successful learners, confident individuals, effective contributors, and responsible citizens. It also states that child protection has to be seen in the context of the wider Gothic, Getting It Right for Every Child approach. So what is meant by this wider Gothic approach? Well, to be clear, it extends way beyond simply ensuring children's safety. Gothic promotes action to improve what is referred to as the well-being of children and young people in 8 areas, and you'll hear a lot more about this, the so-called Shinre indicators. I'll spell it out for you. S for safe, H for healthy, A for achieving, N for nurtured, A for active, R for respected, R again for responsible, and I for included. So the assessment of all children will involve assessment in these eight areas. I must say I've yet to work out whether they're going to assess the 3-year-olds for responsibility, but we'll come to that. But vulnerability, the whole concept of vulnerability, has also moved well beyond the risk of abuse and neglect to include things like the risk of underachievement, inactivity, poor nurturing, presumably nurturing as defined by something like the Triple P parenting program, and irresponsibility. That's what vulnerability is now becoming. Now, to be fair, it is acknowledged that parents and communities have the primary role in safeguarding and promoting the well-being of children, and that parents have ultimate responsibility for ensuring that their children's needs are met. But, and this is the crunch, agencies and services should encourage and support parents and families in carrying out that role. So legislation will have the effect of obligating professionals, not just the named person, to identify deficiencies in parenting and arrange supportive early interventions. Gothic is already having a very significant impact on how health services are being delivered and how responsibilities are being redefined. So if you take, for example, the redesign of the role of community paediatricians within specialist children's services in NHS Greater Glasgow and Clyde, where I work. Whereas previously, our primary responsibility and 80% of our work was involved in caring for children with disability. In other words, the diagnosis and management of children with neurodisabilities or chromosomal syndromes or developmental disorders like autism or language impairment. And with a very much smaller remit for children, for child protection and looked after and accommodated children, in proportion to the much smaller numbers of children and young people involved. In future, the focus of our work is to become vulnerable children. To quote, "The vast majority of medical staff resources will be prioritized for vulnerable children, probably as much as 70 to 80%. So community paediatricians will work alongside other agencies and utilize the Gothic or Shinre assessment tools and assessment framework in relation to children's developmental needs, family and environmental factors, and parenting capacity, to ensure that the needs of vulnerable children are met." So just to make some concluding remarks and referring back to these convictions that underlie a lot of this, the belief that the care of the care that children receive in the first few years determines how they will be in adolescence or adulthood, and that early intervention has to compensate for deficient or uninformed parenting, is essentially a myth. I repeat, it's a myth. However, it has become an absolute article of faith amongst politicians, policy advocates, and also so-called childcare experts. They continually invoke neuroscientific evidence to justify early intervention strategies, and their dubious claims that these strategies will prevent social problems such as delinquency or unemployment and poverty. And this is a real pseudoscience because the evidence does not stand up. In fact, all of these people ignore the substantial body of sociological and scientific criticism of these ideas of the early years and early intervention. But the fact they ignore this testifies to the fact that they are more interested in their ideological agendas than in scientific evidence. Of course, politicians prefer to champion the outlook which regards inadequate or feckless parents as the source of social problems. They'd much rather pursue that idea rather than having to address the much more complicated and difficult structural reasons for poverty, inequality, and crime. But unfortunately, and I think this is something we need to really take account of, unfortunately, these ideas have a very strong hold amongst health and other professionals. So, for example, Harry Burns, until very recently the Chief Medical Officer for Scotland, has made the pseudoscience of the early years and early intervention entirely respectable among health, social work, and educational professionals in Scotland, in countless lectures all around the country. But I'm particularly concerned, in conclusion, about the impact of these ideas on parents. Parents have, just as the previous speakers have pointed out, increasingly lost confidence in their capacity to raise children and manage the normal challenges of their emotional and behavioral development. So even before Gothic and the new Act, large numbers of parents have been seeking referral by health visitors and GPs to child development centres to seek expert advice from community paediatricians or clinical psychologists about what they increasingly perceive as their children's developmental or behavioral difficulties. I have lost count of the numbers of parents that have been channeled into P parenting courses, learning to talk, bounce and rhyme, you probably know them all. And all of these are referrals from primary health and from specialist children's health services. In fact, it is very likely, I think, that many parents will be susceptible to the idea that the named person is a necessary support mechanism, even while they may appreciate that it opens their family to state scrutiny and interference. And just to wind up, I can't tell you how often I now have to say to parents, trust your own instincts. And if needs be, get advice from your own parents, family, and friends, because it's likely to be much better than any program or manual, because they know you and they know your child. And the other thing is, enjoy your children and your shared experiences, and stop feeling that you have to be teaching them all the time or giving them time out perpetually. The only time that parents may need some professional advice and help, and this touches on Mike's point about whether we have anything whatsoever to offer parents in this project, the only time in my experience that parents may need some advice or help is where children's behavioral or communication difficulties are the result of developmental disorders, are the result of chromosomal syndromes or brain injuries. Because believe you me, you can be pretty sure that no amount of P parenting advice or learning to talk sessions will be of any use to these families.